Hey everybody, welcome to this episode of Compassion and Courage, Conversations in Healthcare. This is the podcast where I teach compassionate communication, provide perspective, and inspire resilience. And I am super excited today because I get to interview and spend some time with my friend Richard Corder. Richard, thank you so much for being with me.
It's a pleasure, my friend. It's good to see you again. It's been a while.
It's been a while, yeah. I think we kind of went through a pandemic since we were last in physical relationship there with one another. So Richard, I can't probably introduce you as well as you can introduce yourself, but I do want to tell listeners that of all the people that are in the world of patient experience and healthcare, you're one of my favorite. You are one of the people that I know is always at the forefront of everything that's going on in the patient and human experience world. And in addition to glad you're my friend, I'm glad to be connected with you through the professional means too.
Thank you, man. Wow, that's high praise indeed. So I'm happy to. And same back to you. It's my daughter was asking, what are you doing at 2:00, Dad? I came home early to see you. I said, I'm chatting with a friend. And I said, well, can't you? She said, can't you chat with that friend at any time? And I said, no, well, we're recording it. And she said, you're doing what? So it was just a good reminder that this is time with a good friend, and so it's a treat to be here. Happy.
I'm glad to
give you a little background if it would help, but
yeah,
you tell me.
Yeah, please give me some professional background and what you're doing today, and what those who are listening in that are in the world of healthcare can take from your professional work.
So my professional background is is a little bit of an unusual one in that I started my career out in the hotel business, and I thought that that's what I would do for the rest of my life. And it was actually through the experience of being hospitalized as a patient in Boston was what I now can refer to as my pivot. I don't think I was thinking it was that at the time, but it certainly was. And it was a point in my life where I chose to take a different path, and that path ended up taking me into hospital operations. With a hotel background, the way I got into hospital operations was in through housekeeping, and then ultimately what I call the non-clinical support services. At about the time when this notion of paying attention to the perception and feedback of our patients was becoming more and more important. It was at the dawn of HCAPS, so it was kind of in the late 90s where I kind of landed at a time where that was all happening. So, and then I had a hotel background, I had a bit of healthcare experience because I'd worked as a housekeeping supervisor, went back to school, got a master's degree. So just ended up almost right place, right time, and approached the work to improve the experience of care for those that we were serving by actually paying more attention probably to the experience of care, the experience that was our employees. So did people want to come to work? Did they have the tools to do their jobs? Were we putting them into environments where they could do the best versions of themselves, built on the premise that they would do the right thing by our patients? So that's probably guided much of the work over the years. I've been blessed to do that type of work at community hospitals and academic medical centers, and then also had the opportunity to experience the world of patient safety and risk prevention and loss mitigation with a captive insurance company in Boston. And then it was about that time where I accidentally fell into the world of consulting. I think if you had ever told me I'd be a consultant in healthcare, I'd have probably disagreed strongly, but was drawn to it really from a place of being able to, again, serve others. And it is there that I've enjoyed the last 7 or 8 years of my career, and now I get to do it at an organization called Press Ganey, which I suspect many of your listeners have heard of. Press Ganey.
I would think so. That if you're in a role in the hospital, you're familiar with HCAPS at least, and so tell us how Press Ganey and HCAPS and patient satisfaction, how all that plays together.
So it's interesting that you use those 3 words together. So Press Ganey got its start over 40 years ago, certainly in the world of serving patients, in fact, prior to HCAPS, using its own tools, its own surveys, is, I think, to date, kind of the largest vendor for the HCAP survey. But in fact, Press Ganey has really, I think, proverbially skated to where the puck is in this world of improving the human experience. And it is far less about patient satisfaction per se today, and far more about how do we almost support, invent, reinvent healthcare organizations to take more seriously, perhaps, or to think more strategically about improving the human experience across all aspects of what that kind of phraseology conjures up. Whether you're the human as an employee, or the human as a member of an insurance plan, the human that doesn't think of themselves as a patient, just thinks of themselves as seeing their doctor once a year and is otherwise well, right through to inpatients, outpatients, and all those that we would traditionally call our patients. And how do we listen to those voices and those experiences in a way that allows us to kind of weave it all together and provide ourselves with better intel to ultimately do something differently. So Press Ganey really is no longer the patient satisfaction company or the patient surveying company that it used to be, and is really quite an exciting, we think of kind of human experience platform that healthcare organizations, whether you're a provider or a payer, can use to elevate the experience. That's an exciting place. It's an exciting place to be. It's an exciting place to see this chapter of my career.
Yeah, we've seen the evolution over the last 10, 15 years at least of what equates to a good culture, a good organization. And some of it is, of course, patient safety numbers that you alluded to. Some of it's been patient satisfaction. And now we're really looking at the employees, right? How do we continue the care without turnover in the organization? And Press Ganey and you, I suppose, by virtue of your work, have a new kind of framework that's being rolled out these days. Is that correct?
Yeah, we do. I mean, we're thinking of. I mean, it's we talk about data in black and white, stories in color is a mindset that we have. I think I heard someone the other day say a story is 22 times more memorable than a slide with data on it. And so that's kind of bringing that to life. So it's like, it's one thing to have the data, but what story is that really telling you? And the way we think about how to help folks tell stories in this space is, what data are you gathering? How do you analyze it? How do you then visualize it? And then what do you do with it? I mean, it's all well and good to, and I think, organizations inside of healthcare, outside of healthcare are famous for gathering data, analyzing the what out of it, maybe even making some pretty graphs and pretty pictures with it. And then we don't do anything. We're not significantly better year on year, or we're not doing anything with it. And so I think that's kind of the way we're trying to guide our clients to think about how are you listening, what are you doing with it, how do you play that back so that you see yourselves in it, and ultimately what are we going to do differently with it. So that's it's probably a bit of a twist on how it is we used to do things.
What are we going to do differently with it, right? What are we going to do differently? And so maybe this is the time with all of my students at Notre Dame, the pre-meds that I instruct. By the way, Press and Ganey are both Notre Dame alumni as well.
Right.
So
I
decided to wear my Irish shirt today.
Thank you.
But my first assignment for these students every semester is to write a simple 2-page reflection about a time that someone has been there for them or that they have been there for someone else. And you alluded to a story of yourself earlier as a patient. And so I pose that question to you. Is there Is there a time from your own life that you have witnessed compassion in action, and how do you reflect that compassionate interaction to relate it to the professional work today of advancing that type of feel and culture in healthcare organizations?
Oh, goodness. What a great
Too many
question.
stories to think of,
Oh,
too many
no,
stories.
I love it, man. Your students are lucky people. Compassion in action. Um, I think, well, there's a lot that comes from it. So, starting out in healthcare, having had an unconventional, dare I say, an unconventional academic path was difficult, and had leaders around me not showed compassion to me, so that kind of not as a patient perhaps, but more as just another human, to kind of meet me where I was, provide me a different way of thinking, and then kind of push me to be courageous in a way that I wasn't really ready to be. I wouldn't be doing what I'm doing today. So it was a CEO in the hospital where I was a housekeeper saying, "You really need a master's degree." And then kind of the conversation went something like, "Well, I don't have one. I don't have an undergraduate degree." And he put me in touch with someone at Simmons College in Boston at the time, who again showed, I think, a significant amount of compassion to not just put themselves in my shoes, but then turn what it was I wanted to do into action. And he created a really creative path for me to get into a graduate degree program. And so I, sit here now with a proud kind of owner, if that's the right language, of a master's degree without actually having an undergraduate degree, all because someone took the time to kind of meet me where I was, see that there was something there and give me an opportunity. And not judge the proverbial book by the cover. I think it would be easy to say, well, if you don't have this, therefore you can't do this. So that's just one thing that comes to mind as I think about
That's
that.
great. And that's showing like, hey, let's come up with a creative option for how to accomplish. I just feel like there's in academia especially, we're pretty rigorous with our rules and guidelines and such like that. But I really love to hear stories where there's some flexibility to help a student get done exactly what they need.
Yeah, it's and they didn't make up a story, and I'm guilty of that a lot. They didn't make up a story based upon the limited amount of facts, that would have been easy to do, right? Which would have been, well, what do you mean you don't have an undergraduate degree? You didn't go to school? And not to kind of fill in the blanks, which I think is so easy to do, of therefore you can't, but to actually to use some appreciative inquiry and say, well, how might we? And that, it has been those times and where that has been graciously bestowed upon me that has probably given me some of the greatest opportunities that I've been afforded.
Appreciative inquiry. Those are words that we should keep in mind anytime we're coming up against a situation that seems out of the ordinary. Appreciative inquiry instead of judgment, right?
Yeah. You must hear some fascinating stories from your students when you ask them this.
Yes, I do, and I love these stories. Some of them are deeply, deeply touching, as you can imagine, with stories of their own losses and when people have been there for them. And then, of course, there's all kinds of stories when some of my students already have a clinical background as EMTs or patient care techs, and they're talking about experiences with patients in a clinical setting. So it's a lot of richness in there. And I tell you what, it's a lot better reading those kind of papers than research papers. I'll take the reflections any day over the research.
I love it. I love it.
So So you were talking earlier about this, the idea of what can healthcare organizations do to really help create the cultures and the environment where people thrive and therefore patients will heal and thrive. it, I know that there's no magic silver bullet that everybody, if everybody would just do this, things would all be fine in healthcare. Healthcare is far too complicated, at least in America, to have a one size fits all approach. Yet there are some just general standards I think that we can go by. What's your biggest, I guess your biggest wish that healthcare organizations would take into account to help create these better environments?
Man, you got some good ones, Marcus. I am struck to this day how much we seemingly leave up to chance in healthcare, and I don't think it's with any malintent. Put another way, and I didn't know we were doing it at the time, but when I was at the Four Seasons Hotel in Boston, we did a ton of standard work. We had a standard operating procedure, kind of standard way of doing our work, right down to what side of the table on the salt went on what side of the table the pepper one went, and how you picked up the telephone, and we really trained and oriented people in that. And I think through one lens you could look at that and say, well, that's actually quite pedantic, and that's actually quite silly. But in fact, those standards were what made us so exceptional. And working in that environment, the standard work, the routinized activities, and even routine way that rooms were set up and placemats were laid out and work was organized, allowed your mind or your humanness to be able to come out, because you could kind of you could almost backbrain everything that was routine. And we built systems, and we built we policied, and we trained, and we reinforced. And then we used to have this adage of we inspect what we expect. So if we said, you answer the phone within 4 rings, you answer the phone within 4 rings. And I'm not suggesting that those things can be straight crosswalk to healthcare by any stretch of the imagination. But this notion of what we now call, high reliability is really, when you boil it down to its most basic tenets, I think comes down to, doing what we said we were going to do consistently over time. And I think we don't do enough of that in healthcare. We leave too much either up to chance or up to individual interpretation. And I know some might hear that and think cookbook medicine. I'm not suggesting that. What I'm suggesting is that we can even find ways to communicate in a standard way. We can find ways to collaborate in a standard way. We can find ways to appreciate the work of others in a standard way, whether they're daily huddles or whether they're... So I have a habit that I try and do, a kind of a piece of Richard standard work, if you like, of writing thank you notes every week. And it's a bit of a, maybe it's a little lighthearted in the context of what we're talking about, but the only way I remember to do, it's not the only way, but the primary way I remember to do that is to have a calendar reminder on every Friday afternoon that just says thank you notes. And it's just a hard stop place to remind me to reflect on the week, pull out a thank you note, write one, pop it in the mail. So I think that we could find better ways of focusing at our, even for ourselves as leaders in healthcare. So instead of trying to boil, what are the 3 things, or what is the small number of things that we're going to master and do really well, and do it a standard way, that we know will have a positive impact on our own work, how we interact and work with our colleagues, and then ultimately the care and the service and that we deliver for our patients. There's a quote that one of my colleagues uses that says, attention is the currency of leadership. And I think it's those things that we are paying attention to. And the other thing we used to say at the hotel, we used to say, excellence is a study in boredom. So it's doing those same things over and over and over again, or whether what Gladwell calls your 10,000 hours of practice. Yeah. But it's that. It's, and I think we often scurry around looking for the innovative or the new or the different, or to your point, Marcus, the silver bullet. And I think we have to kind of get back to some of the basics and just do those things really well, really consistently. And then remember that human beings are not necessarily wired like that. So we've got to co-create ways that we're going to hold self and others accountable and responsible for those things.
I love the idea of co-creation right there. And I want to go back to what you talked about, high reliability. High reliability is compassion. High reliability is compassion, and especially in a healthcare setting. If I'm a patient and I know that someone's at least going to be into my room once every hour or two, I can count on that. And having the ability to have my expectations managed and to have that reliability, that is a compassionate act. I also like the idea that you threw out there that what excellence is a study in boredom.
Yeah.
Is that right?
Yeah. Excellence
is a study in boredom. I'm going to have to reflect on that one a little bit more too. Thank you for putting that idea in my head.
The compassion piece of high reliability I'd not thought about either, Marcus. And my head goes to the place of one of the tenets that we talk about in high reliability is this notion of a deference to expertise. And I often think about that as, the people closest to the work know the work better than anyone and are probably the best people to help co-create, co-design new ways of doing the work. And that is, in fact, a very kind of gracious and compassionate act, right? So if I think about it, it's not, three folks sitting in a boardroom up on the fill-in-the-blank floor. Mm-hmm. It's creating a space where the individuals that are doing the, Marge Piercy in her poem To Be of Use talks about, the muck and the mud of work, the kind of in the trenches doing the work. If you're creating an environment where you respect and listen to and appreciate that's, to your point, that's compassion.
Right.
Love that.
And when we think about, I often, the story of Jennifer who held my hand in the emergency room and used those two words, I'm here. That is, in my book, I talk about that compassion is that sense of a parent hugging their child when the child is hurting and vulnerable. That's just the absolute essential of compassion. And that child knows that they can go to the parent because guess what? That parent is highly reliable, right? So I very much see how that reliability works in with compassion. That's a pretty easy stretch for me.
And you reminded me of the parenting idea. It's not to suggest, and it may be a bit of a stretch to throw this out there, but it's not to suggest that I can't do it for you, right? So when Jennifer's holding your hand and saying, I'm here, she can't do it for you. And I was looking at an image the other day of a child climbing across the monkey bars that a colleague had shared with me. And it's the child saying, I need you. And it's the parent standing next to them, kind of about to catch them, but not. And then once she's gained her confidence again, she goes, I don't need you. And then she slips again, she goes, I need you. And the parent never actually catches them. So it's that creating a space where we are there for each other. We're not doing it for each other. And the parenting analogy, I think, is a terrific one because it's that awesome responsibility of I've got to guide you through this thing called life. I'm going to hug you when it's appropriate, and I'm going to soothe you when it's necessary. But how do I also create a space where the child needs to be the expert at crossing the monkey bars, not the adult? The adult's feet can touch the ground. That's not the That's not the work that we're trying to do. But how do we create a space where there is a feeling of compassion? I'm not doing it for you, but I'm creating a space where you can do it.
And you're co-creating this, right? Because
Yeah.
I know that 10 or 15 years ago, when we talked about increasing patient satisfaction scores, you get a lot of bedside professionals that would say, oh, come on, I can't read this script.
Right.
I can't recite this like a script. And part of the reason was because there was no co-creation. This was handed down from administration who got it from somebody else, right? And it felt like it felt like it was too scripted, too structured, I suppose. That, but yet, that really is one of the ways that we create high reliability is through standardization of communication. And I understand the caregiver's side of things, that I don't want to have my autonomy as a caregiver taken away by having to read a script. But I also understand the idea that, guess what? There are best practices for communication. And if we can make those best practices, we're going to have higher reliability and higher quality and less safety issues, et cetera, et cetera.
But I think to your point, because we can honor the humans in that entire space. So we can the high reliability expectation might be that you appropriately greet someone upon entering the room. Now that is a massively loaded statement, and it affords you an enormous amount of space within which to create that. So, but then we need to create spaces where we can have conversations about what does it mean to do that and how do we do it to the best of our ability. So we need to train, we need to support, we need to educate, we need to give feedback. So walking into a room and understanding what it is that or trying to understand what it is the patient, how the patient wants to be called. Do they want to be called Mr. Engel, Dr. Engel, Professor Engel? Do they want to be called Marcus? Is it the morning? Is it the afternoon? I mean, at some point, the notion of scripting becomes a rabbit hole of infinite possibility that you're just going to go down and find yourself in the situation. You're never going to be able to accommodate for every scenario. And I think that's where this gets borderline offensive for human beings, is you must go into this room and do this. I don't think anyone was ever saying that, but unfortunately, somehow along the way, we got into the transactional space of scripting versus being able to communicate an expectation that we will greet everybody in an appropriate way upon entering a room. And that can be an expectation or standard. And then we afford each other the benefit of the doubt when it doesn't happen. We don't just, go to DEF CON, whatever. Doesn't become the, you haven't done this 3 times, therefore you're going to be fired. It's like, then we have the emotional capacity to see the other side of it, but to see the other human being's side of it. With same to the parenting thing, if the child falls off the monkey bars, we don't scold them for being an incompetent monkey bar climber. We put them back up and we figure out whether they want to do it again, and we inquire as to what else they need. So yeah, it's yes and.
Well, Richard, in the time we have left, I don't want to take all your time today, but I want to thank you for being with me. In the time we have left, I got 2 follow-up questions for you, neither of which are necessarily related to anything in our earlier conversation. But as a certified bibliophile, I'm always looking for new reads. So what is on your reading list right now? What are you working through right now?
I'm working through a bunch of things because I don't know how to just read one book, which is part of the fun. I'm looking around my desk, so I'm working through this again, *Sapiens*, which is a brief history of humankind by Yuval Noah Harari, and I've probably butchered his name. And I'm really enjoying the work of Aaron Dignan, Brave New Work, and Frederick Laloux, his work on reinventing organizations.
Okay.
Just 3 really awesome pieces of work.
Okay. I don't know about you, but my list to read, of books to read, is literally longer than I will ever be alive. There's no possible way. So
My bookshelf,
hearing,
though, most of those I've actually read.
have you now?
Yeah, you don't
Good.
make it on that bookshelf unless I've read you.
Very good. My wife and I were talking the other day that it would be so cool to have a copy of every book that I'd ever read. But then we thought we would, between the two of us, we would be dedicating at least a couple of rooms to the house for nothing but bookshelves.
And either in the basement or the ground floor, because those things get
Yeah,
heavy.
yeah. And I'm in Florida. There is no basement.
Ah,
And then my last question for you, it's kind of the quintessential question, but if you had the world's largest billboard on the world's tallest mountain, what's the message that you would want to convey to humanity?
can I split the billboard in half?
Sure, absolutely. You can
So,
do whatever you like. It's your billboard.
so on one side, I'd just put love, just and I just probably put just whether it's in a sentence of love one another. I'd have love, and on the other side, I'd have curiosity over judgment.
Mm, mm. Curiosity over
Yeah,
judgment.
just and there's not a day that goes by. And I traveled today, so I was on 2 different planes, 3 different airports, and you see a lot, and it's real easy for me sometimes to jump to interpreting what I'm seeing through the filter I choose to filter it.
Yes, it's very difficult not to judge. In fact, one of the definitions, my favorite definitions of compassion, is non-judgmental awareness. But it's so hard not to judge. I'm going to judge that guy who's yelling at his kid in the gate area.
Right.
I'm going to judge the fact that this line is too long and it's unorganized and the gate agent didn't announce things properly. I'm going to judge this cup of coffee that I got that didn't have enough squirts of cappuccino juice or
Whatever.
whatever that
Yeah.
goes into it. Yeah,
Yeah.
it's really hard not to judge, but I think it's really important to take a few minutes at a time. And whether this is a meditative experience, but at least once a day, sit there and try to focus on not judging. It's a practice and it's one I'm not good at, but I know it's necessary.
Yes. And then the flip side of it, of remaining curious, and I think it was made famous recently by Ted Lasso, who, if it wasn't a book and it was a TV show, that would be my TV show to throw in there.
Okay.
But his reminder of just remaining curious, just how might we, let's afford each other the benefit of the doubt. Let's be a little bit more gentle in our mindsets and our words. Just I think we need more of that.
I think that your mindset and your words today have given me some things to talk about and think about, and I'm really glad you were with me today, Richard. Thank you.
Thank you for the invitation, my friend. I look forward to us being able to do this in person sometime soon and properly get caught up. You're a good man. I appreciate you.
You are as well, and thank you for being with me on Compassion and Courage. Listeners, again, this is the podcast where I teach compassionate communication, provide perspective, and inspire resilience. If you have thoughts for guests, or if you would like to share anything about the show, any topics that you want to see covered, please visit marcusengel.com. Drop me an email at marcus@marcusengel.com, and we'd love to stay involved and subscribed and engaged with you too. Thank you so much for being with me for this episode.